how do you look at the transition and the challenge that the country is facing while we're adjusting such an important policy in a country with 1.4 billion people and many different layers of preparedness, of awareness, of availability of financial resources, and so on?
Yeah, absolutely. At the end of the day, it's not really a do no harm scenario. It's which approach is going to cause less harm than the other. And as my colleagues have mentioned, now that you have more vaccines and more treatments and things like that, the consequences of getting COVID are not quite as severe as they used to be, although they're still very severe. And so countries around the world, and China in particular, is trying to balance this, right? What is the measured approach to preventing infection and keeping it at a level that is manageable within the healthcare system, that is acceptable within the population, with a dynamic that's changing with new variants, with new countermeasures, and sometimes they work better, sometimes they work less than others. And then to your point, more perhaps even more importantly, is in addition to the medical sciences, the social science. As you mentioned, people approach this from different walks of life, different levels of trust, and so that has to be addressed as well too, to help make sure that people are engaging in the behaviors that we want them to keep them safe.
In terms of disaster preparedness, what is your biggest concern at this moment, watching what's happening in China?
Yeah, I think in terms of for administrators, in a lot of ways, this is actually a more difficult time for policy decisions than early on in the pandemic, because it's such a gray area, right? We have vaccines, but there are new variants coming, and then you have new cases. And so everything is in a state of transition, and everything has some degree of uncertainty around it. And I think it's something to acknowledge and something to be very transparent about. When working with communities, when working with individuals, I think one of the most important things really does come down to the behavioral science. The medical science can create countermeasures and evidence bases and vaccines, but at the end of the day, why are people choosing to do what they do? What are their concerns if they're not doing it? I'm concerned with this elderly population that isn't vaccinated. Why is that? Why are they concerned about the vaccine? Is it an access issue? Is it a trust issue? And a lot of times people need to hear it from leaders in their communities that might not be traditional leaders. They might want to hear it from a professor or a doctor, or maybe someone that they see at the community center who they look up to in the community. So there's a lot of multifaceted work that needs to be done on the social side to make sure that these medical innovations are really achieving their full potential.